The emergency room doors swung open. A paramedic team rushed in, pushing a stretcher. Amidst the flurry of activity, Catherine, a medical billing specialist, sat at her desk. She was ensuring the hospital could function. She was a vital part of the revenue cycle. It's the lifeblood of healthcare, allowing hospitals to keep their doors open and care for patients. Catherine's job was to navigate this complex system, ensuring every visit and procedure was accurately billed. Behind every bill, there was a patient seeking help. She communicated with insurance companies and patients, working closely with her team to resolve any issues, ensuring all paperwork was in order and that financial reports were accurate. It was a challenging job, but one that Catherine found deeply rewarding. The journey begins with the first point of contact, setting the tone for the entire healthcare experience. A patient calls to schedule an appointment, often feeling anxious or uncertain. This initial interaction is crucial, as it builds trust and confidence. It's where vital information is collected, forming the foundation of the patient's medical record. The receptionist gathers the patient's demographics, name, date of birth, contact information, insurance details. Accurate information is paramount for seamless care. A misspelled name, an outdated insurance card, these seemingly small errors can have significant downstream impacts, leading to claim denials and delayed payments, causing frustration. It was about more than just getting the bills paid. It was about ensuring a smooth and stress-free experience for the patients, fostering a positive relationship with the healthcare system. Once the appointment is scheduled, the next step is insurance verification. This is where things can get complicated and often frustrating. The world of health insurance is a labyrinth of plans, policies, and procedures. Catherine's job was to navigate this maze with precision and care. She had to determine what services were covered under the patient's specific plan, what their copay and deductible responsibilities were, and whether pre-authorization was required for any procedures. Pre-authorization, the bane of many a healthcare provider's existence. It's the process of obtaining approval from the insurance company before performing certain procedures or tests. Failing to obtain pre-authorization can result in the claim being denied, leaving the patient or the provider responsible for the cost. Catherine had seen it happen firsthand, and it wasn't pretty. The stress and frustration were palpable. But with determination and attention to detail, she managed to navigate these challenges successfully. With the patient's information verified and pre-authorization secured, if needed, the focus shifts to the clinical encounter. The physician examines the patient, diagnoses their condition, and determines the appropriate course of treatment. This is where medical coding comes into play. Medical coding is the process of translating medical procedures and diagnoses into standardized codes. These codes are used by insurance companies to determine the appropriate reimbursement for the services provided. It's a highly specialized field, requiring extensive knowledge of medical terminology, anatomy, and physiology. Catherine worked closely with the hospital's team of certified coders. They were the unsung heroes of the revenue cycle, meticulously reviewing medical records and assigning the appropriate codes. Continuous education and certification are crucial for medical coders to stay updated with the latest coding standards and regulations. Section 5. From charts to claims. Charge, capture, and submission. Once the codes are assigned, the next step is charge capture. This involves collecting all the charges associated with the patient's visit. These charges are then compiled into a claim, which is electronically submitted to the insurance company. The claim is essentially an invoice, detailing the services provided and the corresponding charges. Catherine's role was to ensure that the claims were submitted correctly and on time. She reviewed each claim carefully, checking for errors and inconsistencies. Communication with other departments was crucial to resolve any discrepancies. By meticulously managing the charge capture and submission process, Catherine played a key role in the revenue cycle. Section 6. The waiting game, claim processing and adjudication. With the claim submitted, the waiting game begins. The insurance company receives the claim and begins the process of adjudication. This involves reviewing the claim to ensure that the services billed were medically necessary and covered under the patient's plan. The insurance company may request additional information or documentation from the provider. Catherine kept a close eye on all outstanding claims. She knew that delays in payment could affect the hospital's cash flow. Section 7. The dreaded denials, navigating rejections and appeals. Not all claims are created equal. Some sail through adjudication without a hitch. Others encounter roadblocks along the way. These roadblocks come in the form of claim denials. Denials can occur for a variety of reasons. Catherine dreaded receiving claim denials, but she knew they were an inevitable part of the revenue cycle. She had developed a thick skin and a keen eye for detail. When a claim was denied, she would carefully review the denial letter and determine the appropriate course of action. Section 8. Money in, money managed. Payment posting and reconciliation. For every claim that is approved, a payment is issued to the provider. This is the moment Catherine and her colleagues worked so hard for. But their work wasn't over yet. Payment posting involves recording the payment received and applying it to the patient's account. This can be surprisingly complex. Payments may be received in batches, covering multiple patients and claims. The payment amount may differ from the amount billed, requiring adjustments. Catherine took pride in her accuracy and attention to detail. She meticulously reconciled every payment, ensuring the books balanced. Section 9. The cycle continues, a vital process for healthcare. The revenue cycle in healthcare is a continuous loop, ensuring financial sustainability while providing quality care. Often overlooked, it's essential to our community's well-being. As Catherine wrapped up, the emergency room buzzed with activity. Physicians and nurses worked tirelessly. Behind the scenes, Catherine and her team ensured the hospital's mission stayed alive. Their efforts are the backbone of healthcare, making sure every patient receives the care they need. In this chapter, we cover the final steps of the revenue cycle: patient follow-up, handling inquiries, and finalizing the billing process to ensure all payments are collected and accounted for accurately. Patient follow-up is crucial. Specialists like Catherine confirm all services are billed correctly and address any remaining balance or discrepancies that may arise. Handling patient inquiries is another significant aspect of the process. Catherine and her team provide clear answers, helping patients navigate billing complexities and insurance questions. They ensure patients understand their bills and insurance coverage thoroughly. Finally, the billing process is finalized, ensuring all payments are collected and any discrepancies resolved efficiently. Through patient follow-up, handling inquiries, and finalizing billing, specialists ensure the healthcare system remains financially healthy and operational. Their work is vital for the sustainability and efficiency of healthcare services. Thank you for joining us. Until next time, stay informed and take care.